welcome to the first episode of the Power of United Impact podcast. I am so excited today to welcome our very first guest. It's Jennifer Jaeger from the American Heart Association. Today, we are here to talk about really the power of United Impact, as I said. And so it's to raise visibility around the partners that are part of the network. And we have 162 right now. But we want to start to spotlight the network partners in a way where we bring additional visibility and understanding around what our agencies are out there doing and how we are working collectively to impact the community. And so I would love for you to help me to welcome Jennifer Jaeger here today. Welcome, Jennifer.
Thank you. So happy to be here.
Oh, we're happy to have you. So Jennifer, I want to start by helping people to get to know you better. So talk to me a little bit about what inspired you to join the American Heart Association.
You know, what's funny is that I have been with the Heart Association for about 16 and a half years. And 16 and a half years ago, honestly, I was introduced to the organization through a previous coworker as a place that she was looking to get a job. And I thought, I've never thought about nonprofit. Like, it had not crossed my mind. But as soon as she mentioned the American Heart Association, I, of course, grew up loving Jump Rope for Heart and those things. And I thought, I'm going to keep an eye on that. So I ended up applying for a position in fundraising, and I got the job, and I've not left. And it's a great place, and I think that's why I'm still there.
Well, we're happy that you're there.
Yeah.
And it sounds like you've been there for quite a while. So I want to ask more to understand, your interest in the American Heart Association and, things that inspire you to continue your journey there. And right now you are the executive director.
Yes.
And so let's talk about some moments that have inspired you beyond the moment where you first said yes to the opportunity. But are there any particular moments you want to point out that have reinforced your passion to stay at the organization?
Yeah, I feel like kind of early on in my career, I was, I would say, fortunate enough that I started in a role where I got to work with a lot of grassroots, really those individual people in the community. And I worked specifically on one of our events, and I met this woman through one of our team building events. And she actually had lost her husband and her daughter to heart disease, and just continue to try to raise awareness around the American Heart Association, just one small piece at a time, whatever she could do. And every year she was a top contributor, a top fundraiser, and I saw the way she did that, and it was really around her passion. And I think that's kind of what hooked me in those early days. And then, as I've continued to stay with the organization, I think the reason that I have stayed is because I see the large scale impact that we make and how it really does matter. And you do see that every day in things that we do. And then actually recently this was just about a year and a half, 2 years ago, I had a new board member join, and he was so passionate about the Heart Association. Got it. Those people who just get it. He lost his mother when he was young, and he was so passionate about making sure that didn't happen to other people. And unfortunately, he passed away in his sleep from very similar issues. And it was probably one of the most jarring moments that I have experienced. And I think about how much progress we have made, because this was not too long ago, right? And the heart disease and the cardiovascular disease and the care and the things that we know, I think sometimes people take for granted, like they think we know a lot, and we do. But things like that shouldn't happen. And we have so much further to go. We have to figure out how we stop that from happening.
Thank you for that. As you were speaking, one of the things that I haven't shared very publicly is that my dad actually had heart disease. And for many years, the American Heart Association was a part of our lives.
Yes.
And so I thank you for the work that you're out there doing, and would love to talk even more about the American Heart Association. So let me ask you a couple of more questions so that we can bring more information to our listeners. So, as I think about our safety net, and you being a very strong part of that, we have about a little over 160 agencies that are part of that network, and they each are out there doing tremendous work.
Yes.
In areas that range from basic needs to early childhood and youth success, health and well-being, which is what brings you here today, jobs and financial stability, community stability, and crisis response. I think about those 40 agencies that fall within our health and well-being space, priority area of focus. And American Heart Association definitely, comes to mind as I think about that. Would love for you to maybe talk a bit more about partnerships that you have in place, other agencies that you work closely with, because we all know that wraparound support is a must,
yes.
right? One agency can't do work alone.
Yes.
And it's probably, I call it mission creep if you focus too far outside of the scope of your agency. And so I like the fact that we have so many agencies that are part of our network that can provide surrounding services.
Yes.
Talk to us about some collaborations.
Oh, we couldn't do what we do without collaborations. The Heart Association, we are not, staffed clinicians by any means, but we bring that science to life. So I would say a good example of that would be we've been working with Affinia Healthcare for many, many, many years. And Affinia Healthcare, for those who may not know, is part of a federally qualified health center networks. And so they have clinics in communities where people need access to quality health care. And so the American Heart Association has worked alongside them to adopt some of our programs that are really bringing the latest and greatest science to their patients, specifically around high blood pressure. That is like our number one. We are really focused on that. Most people don't really realize the high blood pressure is a silent killer. And it is certainly something that if you can get that under control, you can make huge progress. So Affinia Healthcare, we worked with them to adopt our programs. And so they're able to identify those patients who need additional care. And also sometimes they need to monitor their blood pressure more than one time. And so we've been able to provide them with resources to send them home with Bluetooth-enabled blood pressure cuffs, and they can send back information to their physicians. And that way they're getting that continuous care. So I'd say that's probably one of the biggest ones. And then we were able to work with Affinia we did a pilot project actually last year with a food prescription program where we're able to identify those patients who are food insecure, and then let's give them a prescription to actually get some healthy food. And so we have to have those networks of people to help us do that. So Affinia Healthcare helped to identify those patients. They were able to give them the food prescription, and then they were able to redeem that. We were able to collect some data on that. And it was a really great program that we actually were able to see then, even once the program was over, those patients continued to buy healthier food. So it was a really great, I would say, proof of concept for us to show that this kind of work will help people.
I love the fact that you mentioned the food and the prescription program that's attached to that, because I'm very familiar with this.
Yes.
And I mentioned to you that my dad suffered from heart disease. And, one of the things that I found the most challenging was trying to find food that fit within the dietary restrictions that he was given from the hospital. And so I became his chef, really, because it was really trying to understand as quickly as possible some of those restrictions and to find ways to prepare and access the healthy food that was a part of his dietary plan. I want you to talk more about that in ways that, beyond a medical treatment plan, what type of lifestyle changes can significantly reduce high blood pressure and the risk of that?
Yeah. Actually, I think it's said that 80% of heart disease is preventable, which sounds, I feel like that gives us a lot of hope, right? There's a lot of things that we can do. It's not always easy, but there's a lot of things we can do. Actually, this was probably 15 years ago or so, the Heart Association, when we laid out our plan, when we were heading towards our 2020 impact goal, we were looking to actually measure the impact of improving cardiovascular health. Well, how do you measure that? And so we released this program that really focused on those very specific health factors, that it's a health assessment. And we just updated this program. It's now called Life Essential 8. And it focuses on 8 health factors that if you have those under control, your likelihood of developing heart disease goes down, obviously. And so all those things we already probably know. One of them, healthy diet, physical exercise, making sure you're getting some movement in, getting those, getting those steps. I'm sure everybody is familiar with that. Don't smoke. It's just as simple as that. Removing tobacco from your life, making sure you're at a healthy weight, really looking at that BMI. And then knowing those numbers, the cholesterol, the glucose, and again, high blood pressure. And then they just added, which I thought was amazing and such a topic, I think nowadays, is sleep, is really looking at that amount of sleep and restorative sleep. And so there's assessing where you are in those places is really your way to understand what can I work on, what can I improve. And then if you don't know those numbers, I would say that would be a motivation to get those numbers for yourself.
Very good advice. And I think that the key sounds like it's in understanding. Yeah. Okay, let's talk more about cardiovascular disease. And I'd love for us to talk more about it through the lens of populations that are disproportionately impacted by it. And with this being Black History Month, I want us to talk more specifically about just its impact on Black adults.
Yes.
Because I know that 54% of Black adults are more likely to develop heart disease. Can you talk a bit about specific challenges that contribute to the disparity, and what are some of the targeted solutions
Yes, absolutely. We actually just had a 2025 statistical update come out, and I will say that there was slight progress in the disparities, and I think, there's a lot of work to be done, but I thought to me, I was like, okay, that, whenever you're working really hard and you want to just make sure you're doing the right things, I think that is an indicator that we are doing the right things. It may not move as fast as we would all like. But when you look at the disparities, there's so many things to that. And I would say specifically when you look at the social determinants of health, which I'm sure you're very familiar with, really where someone is born and where they live. And I'm sure you've heard the saying that someone's zip code has a better determines whether they'll have heart disease rather than their genetic code. So there's a lot to be said around just like those factors of how someone is their family, where they're raised, or they have access to food. We just talked about that. And so I think that plays a huge, huge part in that. And that's why we have to look at the whole picture and not just the healthcare aspect of that. There certainly is, that's a huge piece of the puzzle, but we have to look at that entire picture as well.
Thanks for that. I think it's important that we, place an emphasis around, just how widespread heart disease really is.
Yes.
I think about conversations I've had even with our board members, and some of them have brought forward examples of, them being impacted directly by heart disease. And so it really brings it home for us when we're in conversations about what can United Way and our network do to, again, respond to the challenges of the entire community, right?
Yes. We had 1 year we kind of did this campaign around can you identify the face of heart disease?
Right.
And you really can't.
I can't.
And I think that that's something that things like this is so important for people to realize the vast scope of it. We always like to share, visuals and think about how you can really, when I talk about high blood pressure and really getting that picture in people's head of what that means, you could fill Busch Stadium 16 times with the amount of people in St. Louis who have high blood pressure. So if you've ever been to a baseball game, imagine 16 more of those. And so it's a big deal. And a lot of those people don't know that they have high blood pressure because you can't feel it. And so it's very important that people are aware and that they have some access to get it checked.
Well, thanks for helping us to put that in perspective when you talk about how many times
16
Busch Stadium switched.
It's a lot of people.
That's alarming. That's alarming. Let's talk about cardiac emergencies.
Yes.
Because I think it's important that we talk to people about just awareness around this and, knowing what to do and how to respond during a cardiac emergency. Why don't you talk to us more about the training that's available and the emphasis you are placing on making sure people remain aware and at the ready, because we just talked about how widespread this is, right?
Yes.
And so if you find yourself in a position where you are, witnessing someone experiencing this, talk about what you all are doing to help equip people.
Yeah, and I will say, just to kind of your point, if you are in a situation, a lot of times it will be somebody that you love, that you may be around and would need to act. And so that is something the Heart Association, we actually, it's one of my favorite things to share about just the research and the impact. We actually funded the science that created CPR in 1961.
Wow.
Which, think about that. That's after the World Wars. So imagine going through those wars and not knowing CPR. That kind of blows your mind. But since then, we own the science, we update the science, and we updated the science in the early 2000s around hands-only CPR. And that has been a huge help in helping us to get that awareness out and kind of removing that barrier of being afraid of adding that mouth-to-mouth piece. And so that's the focus at the Heart Association. We're trying to build a nation of lifesavers. So we want to turn a nation of bystanders into lifesavers. Because about 70% of people don't feel like they have the skills to perform CPR. And again, that's not okay. So one ways that we are doing that is, again, getting that message out there that you can learn CPR in under a minute. We have all kinds of educational videos people can use. You don't have to be quote unquote trained. Really, it's about just recognizing the skill set. I would say one of the most important things to remember is, we've heard the song Staying Alive. That's the pace at which someone needs to go. And hard and fast in the center of the chest is what people need to remember. If they have the ability to have some practice, that's even better. So one of the ways that we are doing that is we are working with community-based organizations, churches, things like that, where people gather, and we're helping them to build in these cardiac emergency response plans. And then they're able to practice and expose people to the skill set of CPR. And that will continue to be something that we expand in the future as well.
Wow. You're making this very accessible when you talk about, moving at the pace of staying alive. I think that probably brought the song to everyone's mind when you said that, mine especially. And I'm like, I never thought about that. So.
Yes. It's the one most people remember, and also the name,
right.
It goes with what you're trying to accomplish there.
Right. So training, very, very important. Let's talk a bit about your relationship with United Way and being a part of the network, and maybe talk a bit about why being a part of the network is so important, and specifically, how has being a part of the network helped to support the American Heart Association?
Oh my gosh, so many ways. I would say when I think about, I worked for the Heart Association for almost 17 years, and I've only ever known us as a part of United Way and a part of this family. And I think about what the Heart Association would look like if we didn't have that, and it would look different. And I also think that, we talked earlier about the full aspect, the social determinants of health and all of those things. And I think that when you look at how we can accomplish our goals, we cannot do that without these partners. And the fact that we're able to access those partners through United Way and lift them up with the support that we have will make us get to our goals faster. And when we talk about the stuff we're doing in St. Louis and the community impact that we're able to have, we're a large national organization. When we talk to other markets, they're like, that is incredible. How are you doing that? And I can tell you every conversation is, well, we have this wonderful support from the United Way. That's why we're able to get these things done. So I don't know what it would look like if we didn't have that. And I think there's a lot to be said, too, about the credibility, because when you talk about, we are and how long we've been with the United Way as far as a key partner, when you're talking to other people and wanting them to get involved with our organization, that provides credibility. And so that's something that is a key talking point.
I appreciate that. What else would you offer our listeners that maybe I haven't asked you questions around to help to bring forward the impact of the American Heart Association, being a part of the network, and our collective impact on our local community?
I would say, ultimately, thank you for having me in Heart Month and this Awareness Month. And I just want to encourage the listeners to be aware and advocate for their health. When I think about everything that we do, at the core of everything we do, I think the most important message that we're able to get out is advocating for your own health. Because at the end of the day, that is truly what you can control.
I love that. And I want to thank you for taking the time out to represent the voice of the network, really, from a health and well-being standpoint. As I said, there are many agencies that are part of the network. There are nearly 40. And I think that this is a perfect example of the type of agencies that make up the network.
Yes.
And the impact of the work that is happening across the community as a result of the good work that's in motion. So I appreciate you, and I appreciate your leadership. I want to go ahead and move to closing. And I thank you all for listening to the podcast. And as I said, this is our very first one. And we want to make certain we continue to bring an understanding around the agencies that make up our network. Who are we comprised of? And again, perfect example, the American Heart Association. If you want to learn more about United Way and our agency network, I'd love for you to visit helpingpeople.org. That's helpingpeople.org. If you want to listen in on the podcast that we have coming soon, we'll have more. You can listen on Spotify or any of our social channels, and we'll be posting this on our website as well. I'm Michelle Tucker, President and CEO here at United Way of Greater St. Louis, and I thank you for listening. And thank you, Jennifer, for joining us today.
Absolutely.